So hi everyone, and welcome back again to my channel. Hope you guys are doing good. Good to see you guys again, and thank you guys so much for clicking onto this video. Today we are going to be talking about mothers who have given birth. Now, the topic of this conversation is sex after birth. What should you do? What should you feel? Is it right? Is it wrong? We are going to be talking about sex after birth. So sex after birth doesn't always feel the same. A few people have different experiences. Obviously, you've had the baby and certain areas have been stretched, and the feeling of sex or the feeling that you feel when you have sex may not be the same. Again, it's different for everyone. Some people could feel the pain during sex. Some people need time to heal, especially if you've had a C-section or if you've had a natural delivery and you had a tear. You need to heal at least 6 to 8 weeks before you go back to having sex again. Even if you've not had any tear or anything after birth, you still need to heal. Your body has been going through so much for 9-10 months, and you need to give time for your body to recover before you can go diving in and do whatever you need to do. There's always a time for everything. So make sure that you are healing, your body is healing back, and your pain is healed before you have sex again. You shouldn't be feeling certain types of pain when having sex. And I don't think that after you had a baby you should be rushing to have sex. You need time to heal. And some people actually don't feel the need to have sex. They don't have the desire to have sex, and the men do not always understand why that is. So if that's you, I'll suggest you speak to your partner, your husband, about how you feel, after giving birth, and so that he can understand, what you're going through. So what could actually cause issues when it comes to having sex after birth? What could actually cause, especially if your first time as a parent, the birth is always something that in a way traumatizes you, and also at the same time it's kind of like a bittersweet moment, After the birth of a baby, the vagina is different. Let's be real, the vagina is different. You have the baby, that area has been stretched, so definitely it would be different. And also you have to remember that you've had to push. You have to remember that you had to push something pretty big out of your vagina. So amazingly, that area is able to stretch to allow the baby to come out. And once the baby come out, it does, go back to normal-ish. Not completely as a virgin, but it does shrink back. Also, when you are very small, usually women are very small down there, and when you're having a baby, sometimes the head or the shoulders are too wide or too big to come out, and sometimes if your vagina is too small, the doctors have to do a little cut on the side for the head and the body to be able to come out. And in doing so, once they cut that, the baby comes out, and then they have to stitch you up for you to heal. And this is one of the reasons why you have to wait till you heal before you can perform any sexual penetration or whatever. So every pain is different, and the reason why they cut it, like I said, is to make the vagina open to enable the baby to come out. So once you've gone through birth, sometimes your main focus is looking after the baby. Your mind isn't always on sex, not for the woman anyway. It's usually the men that are eager to have sex and want to get it on. Meanwhile, the woman is thinking about recovering, the woman is thinking about the baby, the woman is thinking about how to go about the new routine with the baby. So sex is pretty much the last thing that us women think about when it comes to, after birth and, being a mom. Number 2, we have stress. Stress and anxiety can be another reason to not want to have sex or not feel like having sex, because sometimes you're worried too much about how you're going to feel. Obviously things have changed within you and your whole hormones and everything. You don't know what it's going to be like. You have a baby to look after. You don't have time for yourself, and sometimes you don't have time for your husband because you're thinking about looking after the baby. And also a lot of people do worry how a man will see them, after having a child. For example, if a man actually view you down there and view the baby coming out, sometimes they can be pretty scarred, or it can affect them sometimes. And some people don't look down there, some people do look down there, but also depend on the individual. So a lot of women sometimes, feel that the man may not see them, as they did pre-birth or pre-baby or whatever. And that can cause issues in the marriage, in the relationship as well. So once again, it comes down to having a communication with your partner, talking these things through, coming up to, with a solution of how to go about things and see what else will work for you guys. But the man also has to understand this woman has gone through so much in 10 months, having a baby, a lot changing with the baby, a lot changing with the body, and it needs time to heal. So they need to understand the fact that your body needs to get back to normal in order for any normal things to happen again. Like I said as well, it's all about the hormones. Hormones. Your body has to readjust. I cannot explain this enough. You have gone through 10 months of carrying the baby, going through so many emotions. You need to give time for your body to readjust, for you to be able to go back to feeling normal-ish. Some people go through baby blues, where they feel so down at times and where everything is too much for them, where they cannot cope with certain things. This is where the man has to be a little bit more supportive to understand what the woman is going through, hence why communication comes to play. So there's a lot of adjustments that needs to be done after you have a baby. Yeah, so for example, all these adjustments of going back to pre-baby, sometimes, like I said, it can reduce your sex life or your sex drive, should I say, because you wouldn't feel like having sex. When you have pain after having a baby, you're still healing, your concentration is on the baby, you're trying to have a routine for your baby, for your husband, and it's quite difficult. The last thing you want to think about is sex, so a lot of readjustments need to be done. And also for women who breastfeed as well, for women who breastfeed as well, you can have lower estrogen as well. That makes your vagina dry. So when your vagina is dry, you could use lubricants as well when you are ready to have sex. So breastfeeding, the man also has to understand you breastfeeding the baby and what that is also doing to your body. Not in a negative way, but there are times when certain things change when you make certain, changes. And the other thing that I want to put out there as well, especially if it's your first child, there's 2 of you, husband and wife, and then a baby comes into the picture. The man might feel neglected or vice versa. You need to adjust to these changes. I cannot stress this enough. Otherwise, it's going to cause issues in your marriage. You need to adjust and accept these new changes before you can move forward with anything. Otherwise, if you don't accept the changes, you do not adjust to them, you're going to constantly be clashing and having issues and not understanding why certain things have to change. There's a baby involved. It's no longer 2, it's not 3, and you have to make room for that. The other thing I have to make very, very clear, there's another thing called vaginal prolapse, vaginal organ prolapse, which means that when you have a baby, obviously your vagina becomes slightly weak, and it can injure your pelvic floor muscles. It kind of weakens it. So women usually don't tend to find sex enjoyable, or don't like to crave for sex when they're going through this, changes as well. So when it comes to the pelvic floor, there are actually exercises that you can do called the Kegel exercises, and it's a very simple exercise that you can do, because sometimes when you've had a baby, like I said, the organ is weak, and sometimes you may be laughing and your wee is you're starting to wee on yourself, or basically that area is pretty weak because you just had a baby. So in order to tighten that and strengthen those muscles, you need to do an exercise called the Kegel exercise, where the only way I can describe is when you're pulling in your urethra, yeah, that part where you wee from, you need to pull it in. I'm doing it right now, but you guys can tell. You can walk around and be doing it, nobody will be able to tell that you're doing a Kegel exercise. So you basically pull it in, a few seconds and release. Pull it in, a few seconds. I'm doing it, you can't tell. Pull it in and release. It's like you're stopping yourself from weeing, that kind of feeling. That's what the Kegel exercise is. And constantly doing that every day tightens your muscles around your vagina, your pelvic floor. So try and slowly do that when you're ready to exercise, and hopefully that will strengthen the pelvic floor muscle. And on top of that, if you have any issues, I recommend you speak to your doctor, and also always communicate with your husband as well, so that he can be in tune with you and understand what you're going through. Whatever the situation is, there's always somebody to talk to. What you have to remember is that you went through 10 months of adjustments. Even if you have C-section or vaginal delivery, you still need to have time to heal. 6 to 8 weeks is not enough after you've been through 10 months of a whole lot of change. So take it easy on yourself. I know a lot of people want to snap back into, pre-baby figure and all that stuff. Let's be real. Things on Instagram, things on social media showing you, oh, I've gone back to my shape after 2 weeks. Yeah. It isn't doable. Just a lot of pressure for people trying to get back into their body. But I would listen to your own body. Spend time on your baby, be healthy, eat healthy things, and there's always a time, to get that body back. But do not pressurize yourself. So just understand that, change is change, and you just need to find a way of, getting into a new routine and getting things done, basically. So guys, I hope you guys, I hope that was quite useful for you guys. For any new moms, anyone who wants to drop me messages about it, let me know. If you have any questions, do let me know. I don't bite. Share your experiences and let's talk. So I'll see you guys next time. Ciao.